Imagine waking up in the middle of the night with severe stomach cramps, nausea, and an urgent need to rush to the bathroom. You try to recall what you ate earlier, and everything seemed perfectly fine. But what if I told you that a single bite of undercooked chicken or a sip of unpasteurized milk could be the reason you're feeling this way? Campylobacter is one of the most common causes of foodborne illness worldwide, yet many people have never heard of it. In today's video, we will explore what Campylobacteriosis is, how it spreads, the symptoms to watch for, and, most importantly, how you can prevent and treat this bacterial infection. Stay with us until the end, because we will also reveal why even a tiny amount of raw poultry juice can be enough to cause an infection, and why certain people are at higher risk of severe complications. What is Campylobacteriosis? Campylobacteriosis is an infection caused by bacteria from the genus Campylobacter. These bacteria are commonly found in the intestines of animals, particularly poultry, and can contaminate meat during processing. While many people associate food poisoning with bacteria, like Salmonella or E. coli, Campylobacter is actually one of the leading causes of bacterial gastroenteritis worldwide. According to the World Health Organization, Campylobacter infections affect millions of people every year, with young children, older adults, and individuals with weakened immune systems being particularly vulnerable. The most common species responsible for human infection is Campylobacter jejuni, though other species like Campylobacter coli can also cause illness. How to prevent Campylobacter infection? The good news is that Campylobacter infections are entirely preventable by following proper food safety practices. Here are the key steps you should take. 1. Cook poultry and meat thoroughly. Always cook chicken, turkey, and other poultry to an internal temperature of 75 degrees Celsius. Use a food thermometer to ensure meat is properly cooked. Color is not always a reliable indicator of doneness. 2. Avoid cross-contamination. Use separate cutting boards for raw meat and fresh foods like fruits and vegetables. Never wash raw chicken in the sink, as this can spread bacteria through water droplets. Wash utensils, countertops, and hands thoroughly after handling raw meat. 3. Wash your hands and surfaces regularly. Always wash hands with soap and water for at least 20 seconds before and after handling food. Clean kitchen surfaces and utensils with disinfectants or hot, soapy water. 4. Drink safe water and avoid raw dairy products. Ensure drinking water is properly treated and tested for contamination, especially in areas with poor sanitation. Choose pasteurized milk and dairy products to avoid bacterial exposure. Treatment and when to see a doctor. Most cases of Campylobacteriosis are mild and resolve on their own within a week. However, it is important to manage symptoms properly to avoid complications. Home treatment recommendations. Stay hydrated, drink plenty of fluids, including water, clear broths, and oral rehydration solutions to prevent dehydration. Eat light and avoid irritating foods. Stick to bland foods such as bananas, rice, toast, and boiled potatoes while recovering. Rest and monitor symptoms. Avoid strenuous activity and allow the body time to recover. When to seek medical attention. Symptoms persist for more than a week. There is severe dehydration, characterized by dry mouth, dizziness, and reduced urination. High fever or signs of a more severe infection develop. The patient is in a high-risk group, such as young children, elderly individuals, or those with compromised immune systems. In severe cases, antibiotics such as azithromycin or ciprofloxacin may be prescribed, but they are typically only necessary for individuals at high risk or with persistent symptoms. Campylobacter is a leading cause of foodborne illness, but with proper precautions, you can significantly reduce your risk of infection. By cooking food thoroughly, practicing good hygiene, and being mindful of contamination risks, you can protect yourself and your loved ones. If you found this video informative, consider subscribing for more health and safety tips. Share your thoughts in the comments. Have you ever had food poisoning? What was your experience like?